Good afternoon. I'm Alan Unell, and this series of articles is Healthcare Advocacy, where we address problems in the healthcare system and then take actions to try and make a better system for all of us. We're going to be talking about sort of reproductive rights and OB/GYN services and a number of other topics. But before we do, down below in the YouTube description box, you'll find a link to the Healthcare Advocacy newsletter. You can, of course, subscribe for free. And the newsletter is the text for the video. And it has all of the references to news articles, medical journals, lots of resources to help you navigate the healthcare world, all free. Subscribe. Let's first talk about certificates of need. I'm working on this subject, but I wanted to sort of let you know what I'm doing. Certificates of need, you may or may not be familiar, are sort of like zoning for healthcare, in that the government restricts how many hospital beds are available in a particular area. It started, or hospice beds, or medical facilities. Anyway, it started about 50 or so years ago, in the 70s, I think, as a way to make sure that there were enough healthcare resources available and to cut down on healthcare costs. There was quite a concern about that at the time. Now it's used to restrict access to care and civil liberties, and it's not a small problem. There are about 35 states have certificates of need in place. Part of the issue that I'm going to be addressing in the articles is when certificates of need are controlled by a particular kind of organization, typically a religious organization, they get to restrict services for entire counties, and it can be devastating. Anyway, we'll get to that later. I want to talk about contraception, because good news, contraception is going to be covered by insurance very shortly. The Biden administration is now proposing a rule that would expand access to contraceptive products, including making over-the-counter birth control and condoms free for the first time for women of reproductive age who have private health insurance. Under the proposal by the U.S. Department of Health and Human Services, the Labor Department, and the Treasury Department, which was announced by the administration this week, health insurance companies would be required to cover all recommended over-the-counter contraception products. HHS Secretary Javier Becerra said that when health care insurers impose burdensome administrative or cost-sharing requirements for services, access to contraceptives become even more difficult. He continued, "We have heard from women who need a specific brand of birth control, but the cost of their prescription isn't covered by their health insurance. We have made clear that in all 50 states, the Affordable Care Act guarantees coverage of women's preventive services without cost sharing, including all birth control methods approved by the FDA. This proposed rule," he continues, "will build on the progress we've already made under the Affordable Care Act to help ensure that more women can access the contraceptive services they need without out-of-pocket costs." You can read more about that in an NPR article, and of course there's a link in the newsletter. Let's continue. I want to talk about a dangerous lack of birthing centers. More than 400 maternity programs closed nationwide between 2006 and 2020. In rural communities, the disappearance of obstetric services has been particularly impactful. In the decade from 2011 to 2021, 267 rural hospitals closed those services, representing a quarter of all the rural OB units in the U.S. Maternity services typically include care throughout pregnancy, during labor and delivery, and the postnatal period. And without those services, there is a higher risk of maternal and fetal injury or mortality due to complications, such as blood clots, preeclampsia, infection, stroke, excessive blood loss, and obstructed labor, just to name a few. Many of these conditions are preventable or treatable if they're caught early enough. The Center for Disease Control and Prevention reports that more than 80% of the deaths associated with pregnancy are preventable in the presence of adequate maternal care. But when OB services disappear, expecting mothers have to travel farther to receive care. In more than 200 rural communities that lost access to OB services from 2011 to 2021, pregnant women have to spend an additional 15 to 45 minutes traveling to reach care. And there's a link to that reference. It's a real problem. I'll tell you why. If there's been studies done that if you have to travel 40 minutes or more for obstetric care, the risk to the mother and the fetus rises significantly, not a small amount. And so having care close by is really important. The real answer to solving this is to have regional authorities with responsibility and financial capability to make sure that there is sufficiently accessible health care in the region. Just like in H.R. 3421, the vastly improved Medicare for All Act, it's in there. However, until we get that, we need improvements that make birthing care much more accessible. Expanding telehealth to cover areas where gaps exist, that would require partnerships between hospitals in maternal care deserts and hospitals with a decent-sized OB/GYN program. How about running OB/GYN rotations from hospitals with established maternity programs to those in maternal care deserts for prenatal care services? A full hybrid model would include patients traveling to the larger hospital where the OB/GYN originated for labor and delivery, launching mobile obstetric units to reach underserved areas. The Care for Moms Act, not yet passed in Congress, includes grants for rural obstetric mobile units. Those units are not cheap, by the way. To put them together is between $400,000 and $600,000. They're expensive. Anyway, creating incentive programs to encourage OB/GYNs to practice in rural areas, that would help. How about extending Medicaid postpartum coverage from 2 months, 60 days to 12 months? That would help a lot. Anyway, let's take an action on this. Let's use ResistBot on our cell phones and send a text message to 50409. The message is sign, SIGN, space, PNHMXS. Sign, PNHMXS to 50409 on your cell phone, and you'll send this email to your member of Congress and senators. And it's pretty much just what I read you, but I'll read it to you anyway. I'm your constituent, and I want you to know that we have a problem with a lack of OB/GYN services in the U.S., and it's dangerous. Between 2006 and 2020, more than 400 maternity programs have closed. From 2011 to 2021, 267 rural hospitals closed their OB services, and that's a quarter of all rural obstetric units in the U.S. When a woman has to travel more than 40 minutes to get there, her life and the pregnancy are both at risk. I know you don't want that. This is a dangerous situation, and I want you to pay attention and address it. And here's what you can do. And I go through those 4 things. You can expand telehealth to cover areas where gaps exist. You can enable running OB/GYN rotations from hospitals with established maternity programs to those in maternal care deserts. You can enable launching mobile obstetric units to reach the underserved areas. How about passing the Care for Moms Act and get those grants in place? You can create incentive programs to encourage OB/GYNs to practice in rural areas, and of course, extend Medicaid postpartum coverage from 60 days to 12 months. I know you care about healthy women and children. Now show it. Let's talk about hospital greed in the psychiatric world. This is a really odd story. The VA, the Veterans Affairs Department, is investigating whether Acadia Healthcare, it is one of the largest chains of psychiatric hospitals in the U.S., is defrauding government health insurance programs. Get this, by holding patients longer than medically necessary, according to 3 people with knowledge of the inquiry. The investigation, led by the agency's Inspector General, comes 3 weeks after Acadia told investors that it was facing scrutiny for its admission practices from several federal investigators, including prosecutors in Manhattan and a grand jury in Missouri. These guys are dangerous. The company, which relies on government insurance programs like Medicare and Medicaid for most of its revenue, said it was also expecting to receive inquiries, get this, from the Securities and Exchange Commission. This bunch is in trouble. There's a link to a New York Times article on this. All I can think of is One Flew Over the Cuckoo's Nest. Okay, let's talk about CVS, because CVS workers have had enough. And this is if you like irony, this is a story of irony. Workers at 7 CVS pharmacy locations in Southern California have gone on strike for better pay and, get this, better health care, and to protest what they say is a bad faith contract bargaining stature by the company. The walkout affected 4 stores in LA and 3 in Orange County. It began last week on Friday, and it's continued into the weekend. On Saturday, outside one of the LA stores, strikers urged customers not to cross the picket line. Now, let me tell you something. CVS Caremark is one of the giants in the healthcare world. They own Aetna Insurance. They own CVS stores and CVS Caremark Pharmacy Benefit Manager Corporation that makes more than all 10,000 CVS stores, period. The workers want better health insurance. Look, universal health insurance, that's what we should have. Just say it over and over and over again. I find it particularly ironic that this bunch sells health insurance and yet their employees are striking for better health insurance. Look, you can just call your member of Congress, tell them we need universal health care, and get it over with. In the newsletter, there's a link to to how to reach them, and I'll have it in the YouTube description box at the bottom in the resources. I want to talk briefly about insurance companies cheating somebody else. Get this, doctors. Now, if you're like most Americans, you prefer to be paid electronically if you've got a bank account instead of with old-fashioned paper checks. But imagine if your employer forced you to take a 2 to 5% processing fee out of every paycheck just for the convenience of direct deposit. Now, I know it sounds ludicrous, but this is what America's doctors are up against as healthcare insurers and their payment processing middlemen continue to include hidden predatory fees on every electronic fund transfer that they make to doctors. Such penalties of convenience create administrative burdens and cut into the practice's razor-thin margins as they struggle to stay afloat after years of stagnating reimbursement from these insurance companies. These fees benefit nobody except the middlemen and who use them and put it in their pocket. P.S. The cheapest solution for the insurance company is an electronic funds transfer. It costs next to nothing. It's a penny's cost. Cutting a paper check and mailing it to somebody costs several dollars per check. These guys are just scum. Pick universal health care. Here's a bonus action for you, especially this week late in October. I want you to vote accordingly up and down the ballot for people who are willing to protect and stand up for your rights and make lying wrong again. Okay, that's what I've got for you. Have a good evening. Down below you can like, share, and subscribe and send me comments or recommendations for investigations here or at healthcareadvocacy1@gmail.com. Have a good